Right before India began reporting a massive surge in cases due to a deadly second wave, social media had been littered with exotic images of influencers, celebrities and newlyweds enjoying themselves on a luxurious holiday in the Maldives. The islands have been a popular pit stop for newlyweds since quite some time, and tourism continues to be a mainstay for the economy. But now, as India records a deadly second wave, there are travel restrictions in place on Indian holidaymakers. Cases are surging in other countries as well as of now. So what happens now to the tourism sector in the Maldives? Will the Maldives vaccine tourism program help the sector to revive? To answer all these questions, joining me now is Dr Mausoom, the Minister of Tourism in the Maldives. He joins us from Mali. Dr Mausoom, thank you so much for talking to us. What do you make of the situation in India as of now?
Yeah, first of all, we are really with the Indian people. We feel for the Indian community. We are very close neighbors, and things were moving very well a couple of months back. And now that this spike has come, it is a big concern for all of us, and our hearts go out to the Indian people.
Now, assistance is pouring in from around the world, but at the same time, more than 10 countries have now imposed travel restrictions of some kind, including the Maldives. So what kind of restrictions are now in place for Indians traveling to the Maldives?
First of all, I wish to thank the Indian government for the kind assistance the Indian government has rendered to the Maldives in terms of vaccines and other support. Of course, we started with the travel bubble, very productive one. As we opened our borders, people were still not not coming to the Maldives in so much huge numbers. We started the Indian travel bubble, and that helped a lot. And of course, the Indian tourists now comprise 23% of our traffic. And now with the recent developments, the number has come down a bit. Earlier this year, we were getting 800 tourists a day, but in April, we are getting average 600 tourists a day. But the most important thing is Indian tourists, especially the Bollywood stars and other Indian tourists who have been here. They have helped Maldives really shine through as a preferred destination. So we appreciate that, and we thank everybody who has come to Maldives. And now the change we have brought is a small restriction for tourists traveling from India. They can still come and stay in our beautiful resorts, one island, one hotel type of development. So they can stay in the resort islands. Also, they can stay in the safari sector, the liveaboard boats. Only the restriction is at the moment tourists traveling from India. We have temporarily suspended their travel to hotels and guest houses in inhabited islands.
My next question for you, which sectors are now out of bounds for Indians altogether?
It is just one sector, because Maldives, we have got three major sectors. One are the tourist resorts that the Maldives is very popular for, very famous for, one island, one hotel type of resort. In fact, that is one of the reasons why we were able to move on with the tourism during this crisis with safety measures. That is, so that sector is still very much open. And safari sector, liveaboard boats, that are also very popular sector, that's very much open. Only the hotels in islands where common Maldivians are living, that is where the restriction is.
The pandemic began more than 16 months ago, and as we now start vaccinating people around the globe, the virus is fighting back through different mutations. So are you worried about the second and possibly the third wave in COVID-19 cases?
It is a concern that the world is still not taking a full grip of this crisis, but we are more confident than before now, because Maldives has started our vaccination. It's going on well. In the resorts, almost all the resorts, 100% of the staff have got their first dose, and we have initiated our second dose. And the Maldives population also, we have got over 60% of the population has got the first dose. So if you compare to the time when we welcomed 2021, we are in a very much better situation. But nonetheless, the changing COVID scenario in different source markets is a concern. But we are more optimistic with the rollout of the vaccines everywhere. And we are hoping that in the coming months, things will be better. The scientists will be able to come up with better inventions that will help us deal with this crisis.
Dr. Mausoom, do you think the mutations will postpone the global recovery by another year?
From what the scientists say, that is so. But Maldives Tourism, we have developed even on day one, when President Ibrahim Saleh decided to open the country for tourism, we developed a model whereby we could function with this crisis. So we have got safety protocols in place whereby Maldives tourism is now designed to function with this crisis. But of course, it will be much better without crisis. In the coming days, we hope that the whole world will be in a better position to manage it. As for the Maldives tourism industry and our health sector people, as you mentioned, over the last more than a year or so, we have been dealing with it. And since we opened the border, we have experienced, we have got a better experience of how to handle the situations that may arise. And we are now very much geared to move on this. We hope that COVID go away.
Let's talk about the vaccination drive in the Maldives. More than 50% of people have got their first shot in the Maldives already. And now you are planning to offer vaccines to holidaymakers who visit the country for a trip. Tell us more about this program.
Yeah, the priority of the government is to ensure that the Maldives population, including the expats here, they get their vaccination first. So after that, we will move on to the 3V visit vaccinate vacation program. We have got a kind donation from India and China, and also we have placed orders for vaccines. And when we get, because of our small population, fortunately, we are going to have a bit of a surplus after we vaccinate the whole population. And this 3V program is our way of thanking the tourists who have decided to come to the Maldives when the world was closed. The tourists who showed to the world that it is okay to holiday in the Maldives. So the vaccination program is our way of appreciation.
So is vaccine tourism now the only way forward for countries like the Maldives, which depend heavily on tourism for their revenues?
The model we started with is a negative PCR. Okay, so negative PCR is still continuing, but we have rolled out the program of tourists who have got vaccine certification. That's 2-dose vaccine plus the required duration. They will be allowed to come into the Maldives and have their holiday. I think that's the way forward. That is what international tourism organizations are talking about. That is what many destinations are doing. It vaccination is the way forward. So we are working on it. We hope that more people will get vaccinated. I think vaccination of our Maldives population is not enough. Of course, our tourism frontliners are going to get their second dose, and they will be pretty much immunized. But for tourism to function is a tourist activity. Tourism is an activity of happiness, people enjoying. And for that one, you can't be far away from each other. You can't be wearing the mask. You have to make things move on. But the new normal today, as of it, we have to live with those restrictions. We have to wear the mask, stay away, and do all this to be back to normal. I think vaccination will be the way forward.
Right, now let's talk more about vaccines. Safety is everything, but the world is divided on vaccine standards. We have now seen how Europe went back and forth on AstraZeneca vaccines, and unproven vaccines like the ones from China are being widely exported. How will the Maldives decide when it comes down to procuring the supplies for your vaccine tourism initiative?
With regard to the COVID management and the industry protocols we set up and other aspects we have set in the Maldives, they are very much in the guidelines of WHO. So World Health Organization will be the leader who would guide us on our protocols. As you say, still we are. This is very early days, even into the vaccine and all that. But I think every day that passes gives us more information, more evidence on what is working, what is not working, and various protocols. And I'm very happy of the WHO's approach, and I'm very confident of the Maldives health sector, health authorities. The steps they have taken are very firm. They're very, very strong. It has worked. And for the vaccination also, I think their protocols will be very good. Their protocols will be guided by WHO and other science information out there.
Now, since we are talking about vaccines, let us discuss the global vaccination drive. Right now, we are witnessing a major divide between the developed and the developing world. Rich countries are inoculating their citizens much faster since they have been hoarding supplies, as we have seen. Do you think this is hurting the global efforts to end the pandemic?
Unfortunately, the world production has been much less than what is needed. And I think there is an acute shortage of vaccine at the moment. But as I said, as the vaccine producers move on towards better production, eventually we will have enough supply. Till then, there are difficulties as many news channels are covering who gets it, who doesn't get it. That's always debatable. I think it is important that we have mechanisms whereby the vaccines are made available where it is needed most.
So what kind of global initiatives would you like to see for vaccination drives?
I think very true. I think the global initiative, the COVAX program that most of the countries are enrolled into, it has got a distribution which is based on the population. That's why Maldives has got a small population. We got a small but an important contribution, an important quota from that program. I think the world has always united in this type of crisis, and they have always worked hand in hand towards delivering medical supplies and other support where that is needed most. And I'm very hopeful that this will happen. And when a particular part of the world is in a deeper crisis, I think everybody else try to give some support to the area that is in that needs more support.
Right, Dr. Mausoom, now countries like India have called for a waiver on vaccine patents at the WTO to scale up production. Where does the Maldives stand on this proposal as of now?
I think the most important aspect is safety. Safety should not be compromised. And I think that is why even the COVID vaccines, it took nearly an year to be rolled out. Fortunately, some companies decide to go on with the production, even though that could actually may not be approved, but they managed to move on with that decision. I think the health authorities, international health authorities, and the health authorities of the country concerned will have a say on that one. The most important thing is saving lives, and whether are you going to wait till all the protocols are completed and you get the appropriate certificates for that, or will you be able to authorize it and move on when it is really needed? I think many countries has given temporary licenses based on the emergency situation.
Humanity is navigating uncertain times. Do you see any global recovery this year? And how do you see the end of this pandemic unfolding?
I think the Maldives tourism, we are very much on track now because we have got the protocols. We have worked it for since even opening the border. We have worked for about 9 months now, and it is we have got a grasp of it, and we will be able to manage it. But the most important thing is how is this totally for, I mean, we need to make sure that our source markets like India are relatively COVID-free. And I think the basics that we learned on day one, we have to keep reminding ourselves of that. Social distancing and mask and frequent washing of hands. These may be the very basics, but these basics keep COVID at bay. That I think as we have moved on all these months, all of us have become kind of used to it, and we kind of take it for granted. And sometimes people don't want to wear the mask or don't bother wearing the mask, or they don't want to keep the social distance. That makes this COVID spread. With vaccination, with proper social distancing, I think we will have a very reasonable recovery in the coming months. As for the Maldives, this year we have termed the year as the year of investment, and we are focusing on new investments to take tourism to the people, so that island communities will have more engagement in tourism investment, tourism employment, more women engagement in tourism. And 2022 is going to be our golden jubilee for tourism. So we are marking year 2020 as the golden year of tourism. As we move on, we hope that with the global vaccination program plus the national vaccination program, we'll be very much geared to move on with the tourism in near normality, but to be totally normal, it may still take some time.
And that brings an end to our discussion. Thank you so much, Dr. Mausoom, for speaking to WION. It's evident now that vaccines are the only way out of this pandemic.
Thank you very much. Once again, our thoughts and prayers are with India and people of India. We hope that you come out of this crisis soon. Thank you.